Okay, I am recording, and for starters, if you don't mind giving me your name and the spelling of your name, and then the title you would like to see on the air.
Okay, my name is Mahmoud Malas. The spelling is Mahmoud, the first name, and the last name is Malas, Malas. My title, I'm the Chief of Vascular and Endovascular Surgery at the University of California, San Diego.
So fascinating that as COVID goes along, we keep finding out more and more about the damage that this virus can cause. Can you tell us what you've learned from your study?
Yes, unfortunately, we continue to see that there's a lot we don't know about this virus, and there are a lot of reports that documents increased risk of clotting in patient with COVID. Not only the patient with severe COVID, but even with the mild and moderate cases, we're seeing some of the patient actually presenting, instead of respiratory symptoms, they're actually presenting with clot in their arteries or vein.
I think just a few months ago, a study came out about athletes suffering from this, but you're finding this with more and more patients.
Absolutely. So, initially, as with any new disease, and we're trying to learn, there will be a lot of new studies and publication published, but the number of patients in each study might be small because it's a new entity. What we were able to do here at UC San Diego, our team of researchers were able to collect more than 400 studies published on the topic. And out of those, 42 studies met the inclusion criteria, and we found in about 8,000 patients collectively, we're able to give you a pooled rate of clotting. And the clots can happen in the vein or in the artery, but the risk of clotting in the veins was over 20%. And if the patient were in the ICU with severe COVID, almost 1/3 of the patient had clotting in the veins. And the other interesting finding of our studies is that a patient who had a clot versus patient who did not have a clot, there was increased risk, almost 75% risk of mortality. So meaning if patient have COVID with clot versus COVID without clot, there was about 74% increased risk of mortality.
3 out of 4 of those patients would probably die, is what you're saying.
No, the risk, the way to interpret this is that the risk of dying was 74% higher if you have COVID with clot versus if you have COVID without clot.
Now, was this study done on hospitalized patients or just patients in general who have COVID?
This is a very good question because this is only patients who actually were admitted to the hospital or they were in the ICU, which lead to the point that probably these numbers I'm giving you are an underestimate because there are a lot of patients who have COVID and we're not specifically trying to find clot in them. So they might have a silent clot that we don't know about because we did not really study or do the proper testing to evaluate the veins, for instance, where the clot's happening.
Now, typically these days we're hearing, about coronavirus or COVID-19 being a viral respiratory illness, but this kind of changes that quite a bit.
Absolutely. So what we're learning is that the virus can attack the lining of the arteries and the blood vessels from the inside and damage the intima, which is the fine layer that cover and the arteries and veins. And we're finding that the virus have the ability to aggregate platelets, which are natural component of the blood that help the body form clots. But in this scenario, they're overactivated, so the patient have higher tendency to make clot than usual.
Have we gotten as far to figure out whether or not this is the virus causing the damage or whether or not it's the immune system overreacting and causing this damage?
Also very good questions, but we finding so far we don't really know. What we've seen is that there is more and more damage in the artery. We've seen younger patient who have no high risk because we keep hearing only older patients who have preconditions are the one at risk. But what we see in actually younger patients who have no risk factors presenting with clots, in the artery or in the vein. And clots in the artery is actually more dangerous because if it happens in an artery in the leg, for instance, the patient can lose their leg if we don't operate immediately or remove the clot. We also see in some patients that having clots in their carotid artery, which is the main artery that supply the blood flow to the brain, and patient presenting with stroke. Again, these patients have no prior risk factors. They're not necessarily older, they're not necessarily smokers. So that's the unusual finding. We still don't understand why some patients get COVID and have very mild case of COVID, and some patients come in with very severe disease, pulmonary disease. And also we don't understand why not all patients having clots in their artery and vein, not all COVID, but almost up to 1/4 in our studies, which is pooled again of more than 42 studies, nationally and internationally.
Important message there that I almost want you to say again. Younger people who are getting coronavirus are also being affected with these blood clots.
Absolutely, it is very important, and we have several cases that we took care of at UCSD, and I'm also aware of several cases nationally that we communicate among the vascular community is very close and communicate with each other, but I'm aware of many cases on the East Coast and the Midwest that actually happen in younger patients who have no risk factor, and they actually present sometime with a clot in their artery. And we have to do an emergency surgery to save the limb.
Amazing. What's next? What do you've gotten this information now? What do you do with it?
I think this study underline a very important issue, which is that we have to have very high index of suspicion as physician that we treat COVID. When a patient in the hospital typically, and they have higher risk of clotting, we need to do our due diligence and give them anticoagulation, which is becoming now the standard. All hospitalized patients with COVID get some sort of prophylactic anticoagulation. But there are also a lot of studies recently showing that some of these patients are not responding as well to the anticoagulation that a patient without COVID might respond to. So we have to have high index of suspicion. If there's any symptoms or any question, we can do simple ultrasound to rule out a clot in the vein or in the artery. And we have to prophylactically treat these patients. But more importantly, if we see young people presenting with symptoms that does not look right, they might not even have COVID symptoms. We need to be very, to have that high index of suspicion to essentially order the proper testing to evaluate and rule out clot.
Amazing. Just any message out that you have, as somebody that's, seen a lot of sick patients from COVID-19 and speaking to our viewers of how serious they should take this illness?
I mean, I think this again shows that people underestimating how serious this disease is. And it goes without saying the importance of social distancing and wearing a mask, and hopefully we will have a vaccine soon. But not everybody who get COVID gonna have a mild case and completely have no sequelae. This is very serious, and it could turn into a very serious condition.
And it also sounds like, from what you're saying, the vaccine isn't necessarily the goal line here. There's still a lot more research to be done and trying to figure out how this virus affects the body.
I mean, absolutely. What we know about the vaccine is that there are several promising studies of several vaccines that hopefully we're going to have soon. But we still have a lot of challenges of stabilizing that vaccine, being able to deliver it to massive number of the entire population, essentially. And we know that these vaccines are not necessarily easy to transport. They require, some of them, minus 100-degree temperature. So it's, even if we have that vaccine, hopefully in the next few months, it doesn't mean that we're going to be able to deliver it to everybody quickly. And that, again, stress the importance of us taking our own responsibility of being safe and keeping the social distancing and wearing a mask at all times.
Important information. Thank you for speaking with us today. Appreciate it.
Thank you so much. Thank you, Mario.